I'm going to be presenting on a community needs assessment. This was done in Yulee, Florida, between the months of June and July 2023. So my first step was the assessment. So the target population was the underserved, food insecure, low income, and uninsured adults in Yulee, Florida. My goal or purpose of the assessment was to observe and find out what is accessible to the population in regards to health centers, food, transportation, schools, and access to public parks. And with understanding that, we can figure out what their needs are and what a community dietitian could, work towards to give resources to the community. So some objectives for the needs assessment included locating gas stations, grocery stores, health centers, schools, and parks, understanding what food is accessible to the population, understanding if there are spaces available for the residents to do physical activity, and analyze how accessible their transportation is for the target population. So my next slide is pictures of the hospitals and healthcare centers. So there's really only one at the moment. It's UF Health Wildlight, and then I have a photo of a sign saying Baptist Nassau Crossing. It is being built. It's currently being built. It's been worked on for a while, so I'm not sure when it will be ready for the population. The next photo is pictures of grocery stores in the parameter. So there's a picture of Target, they have Winn-Dixie, and the Winn-Dixie at the pharmacy, they have an Aldi, and they also have a Publix. So they have a variety of major chains of grocery stores. The next photo is of the food marts, convenience stores, and gas station markets. So we went to a 7-Eleven and a Circle K, and inside the 7-Eleven there was a very large variety of different foods, even fresh foods that were kept cold. For transportation hubs, there are none available in the parameter currently. For schools, there is Yulee Middle School and High School that are available for the community. In regards to public libraries and parks, FSCJ, which is a college, has a public library for the public, so anyone can go, even though it's part of FSCJ. And then there is one new public park we discovered on our drive. It's very new. It wasn't very large, but there was one park we found in the area. My next slide is of the map of the drive. So the first photo, I just kind of have it zoomed in more. You can see where the photos were taken along the road. We were basically going down A1A for the majority of it, and then went down through some neighborhoods to find other parts. And then the second photo, I've just zoomed out more so you can see how we were heading from Fernandina, driving through Yulee, driving towards Callahan. So for the data collection, for gender, it was pretty much for Nassau County, Florida, and the U.S. It was split between male and female pretty evenly. For the age, for the Nassau County, the majority of people are 65 and over, and next comes people under 18 years. And Florida and the U.S. Florida had a similar trend. The U.S., the majority of its people are under 18 nationally. For the average household size, Nassau County had 2.53 persons per household. Florida and the national statistics were pretty similar. The median annual income for Nassau County was $77,000. That was higher than what I expected, and I feel that because there is a portion of Fernandina that is pretty wealthy, it brought up that average a lot. And I think if Fernandina Beach didn't exist, the median household income would probably be a lot lower. The income for Florida is $61,000, and income for the U.S. is $69,000. For the education level, 91% of Nassau County was a high school graduate or higher. That's pretty good. I was slightly surprised at that. And then for a bachelor degree or higher was 31%. That I kind of expected. For Florida, it's similar and same with the U.S., the national education level. Now for race, 89.8% of Nassau County is white. I did not expect that. Seems pretty high to me compared to other places in the country. And then the next highest is Black or African American at 6.4%, and then the rest are the others. Well, and then there's Hispanic or Latino, that's 5.5%. But yeah, the rest of the other races are much lower percentage in Nassau County. For Florida, 76.8% are white, so it's a chunk lower than just comparing to Nassau County. And Black or African American makes up 17% of the races in Florida, so it's definitely higher than Nassau County. And then for the U.S., its statistics are similar to those of Florida, pretty much. So next, the poverty level. In Nassau County, 9.9% of people are in poverty, and 25% of Nassau County is at the Alice poverty level. 41% of Callahan is at the Alice poverty level, and that is only for those who are employed. So I feel like that statistic gives a better idea of how many people really are suffering from poverty in this county and in this area. Florida, its total percent of people in poverty is 13%, and then the national average is 11.6%. In regards to food security, Nassau County in 2016, 31.6% of its people were food insecure. And then I saw another statistic from 2021 that 46.4% have low access to healthy food. So I would assume those people are in a very similar boat as food insecure individuals. Florida was a lot lower. Florida as a whole, 8.6% are food insecure, which still is not great, but it's a lot lower than 31%. And then the national average is 12.3% being food insecure, and that was back in 2016. For labor force, 56.8% of Nassau County is in the labor force. For Florida, it's 59%, and for the national average, it's 63%. For obesity prevalence, moving to health-related factors, Nassau County, 64%. Is for Nassau County. Florida is the same, and then national in 2020 it was 41.9%. Next, death related to diabetes in Nassau County, it was 54 per 100,000. Florida is 22.4 per 100,000, and then in the national I just had 103,294. That was just per 1 year. So, regardless, you can see that it's a high death rate related to diabetes when you compare Nassau County to Florida. It's almost like twice it's actually over twice the amount. It doubles in Nassau compared to the rest of Florida. With coronary heart disease hospitalizations, there were 259 per 100,000 in 2021. That's a little bit higher than Florida's, which was 242 per 100,000 in 2021. With homicide, I was able to find information homicide related to drug poisoning. So there is none in 2021, and there is 6 total in Florida in 2021. In regards to cancer, Nassau County has a cancer incidence of 562 per 100,000 people, and in Florida it's 431, so it's much less. So that is something to consider. Cancer incidence is pretty high in Nassau County as well. Next, religion. So in Nassau County, majority are Baptist at 23.1%. And then it says 7.3% are Catholic. And that's very different from the national rate, which 70.6% are Christian, and then 20.8% are Catholic. And then when it comes to Florida, the statistics said that, first of all, only 39.7% of people are religious to begin with in Florida, and the highest was Baptist as well, but that was at 8%. For life expectancy, Nassau County's life expectancy ranges from 76.2 to 79 years. It depends if you're male or female. For Florida, females live up, the expectancy is 80 years, and for males it's 74 years. And then for national males, it's 74 years as well, and for females, it's 79 years. They have similar statistics. Alright, so moving into the major community resources. First one I listed was UF Health Wildlife. I had a photo of it earlier. It's mainly in urgent care, but it also provides primary care, imaging services, pediatrics, gynecology, mental health services, dentistry, and a laboratory. And I mentioned as well before that Baptist Nassau Crossing is currently being built, and that will provide in and outpatient services, but they don't have one at the moment, and I know they've been working on it for a while. Another resource is Family Support Services. Their mission statement says that their primary goal is to assist families so that children can live at home in a safe, healthy, and loving environment. They build community relationships that positively impact and preserve families in order to prevent children from coming out into the system of care. Another resource is Gracie's Kitchen. It's a nonprofit organization that serves single mothers, families, senior citizens, and military veterans, the homeless, and the working poor of the Yulee area. And is open 4 days a week. Another resource is the Yulee United Methodist Church. It's open every Wednesday, and it gives out a variety of foods. There is the Journey Church. It holds a food pantry as well, and it gives free meals for children over the summer across the state. There were no economic resources that were identified. So I interviewed the community, and I listed the 9 questions I asked them. It consisted of social and cultural norms, health beliefs, knowledge, self-efficacy, and nutrition-related attitudes. So I have those 9 listed that I asked, and then next I basically summarized the responses that I got. It was pretty interesting to me. You can see those there in the next 2 slides. And so my analysis from that, Yulee seems to have a sufficient amount of access to urgent cares. The area seems to be moderately safe, and these are the strengths. There is access to plenty of grocery stores and food marts, as well as fresh and frozen fruits and vegetables, and they do have resources for those struggling with food or mental health, etc. Some weaknesses that included were There was lack of public parks and areas for recreational use and exercise. As I had said before, we only found one small park that was fairly new. The area lacks an established hospital, and there is no public transportation. All the grocery stores, they seem to be kind of within the same area of Yulee. So as we got farther towards Callahan going to Yulee, there was less and less resources, and there were no public shelters. Car transportation is needed to go to the majority of the resources, so if you only had a bike, it would make it very difficult to go to these resources. So the overall impression, I basically just summarized it by, as we drove through Yulee, going from Fernandina Beach to Callahan, it became much more rural, and there were less establishments and businesses. The houses seemed to become a little bit more run down. There was a gradual but noticeable shift in the socioeconomic status. And then in regards to food quality in the stores really did seem to be well equipped, and there were several stores available, and the food prices seemed pretty standard, and there were fresh fruits and vegetables available. It seems that they need a hospital for the area as well as shelters. I don't believe there were any shelters in the area. The area does have plenty of grocery stores and food markets, as well as organizations for donating food for those who cannot afford it, which is great. There is a need for more public parks, and as I said, it would be difficult to live and thrive in Yulee if you did not have shelter or transportation. So what I learned about the population's needs, wants, motivations, etc., the community does not know the difference between whole and refined grain. That's what I learned from the interview. The community is very reliant on food pantries for food. The community does not prioritize exercise, leading me to believe that health may not be a top priority for this group, nor do they have much access. Part of the population smokes very heavily, and the majority of the community said they know how to eat a healthy meal, but they did not know how to explain how to do so for many. For the literature in regards to the population's nutritious status and health beliefs, I found that death from diabetes is very high in the county, and there's a high percent of people living in poverty and food insecure in the county. For my interview, I was told by the community, like I said, they know how to eat healthy, but they couldn't explain how to when prompted. And in regards to literature, talking about effective means of intervention for this community, I didn't find any specific to the community. I did find a systematic review, and I found that providing food and monetary assistance to food insecure adults was associated with improved food security, but whether it was translated to better health incomes or reduced healthcare utilization was never clear. And while the intervention that I created did not provide food or money, it was a source of education with how to eat the food that was given. So opportunities in Yulee and Nassau County include, there is for Barnabas, where I'm interning, they have a program called Food for Healthy Living that individuals can be signed up for if they are a patient at the medical clinic and suffer from diabetes or hypertension. It's a great resource because it allows individuals to bring home several fruits and vegetables, as well as whole grains and food low in fat and low in sodium. There is an opportunity for affordable housing and shelters, and there's also an opportunity for public transportation. Some threats in Yulee include there's little access to parks or exercise. There's only one established hospital in Fernandina Beach within all of the county. So Yulee lacks a hospital, and that is creating a more dangerous environment to live in. When you don't have a hospital closer to you, it becomes less accessible. There are not many areas that are bikeable. The lack of shelters is supporting homelessness. population's needs are not met for those who are homeless or lack transportation, and the homelessness population, it is growing. Some are coming from Jacksonville. So step 2 is the diagnosis. So little access to inpatient care related to the recent growth of population, as evidenced by the lack of a hospital in Yulee, Florida. So this PES statement, it indirectly correlates with the dietary guidelines for Americans, because I quoted from them how health professionals, businesses, industries, etc., all play a role in supporting individuals and families and making choices that align with their guidelines. So step 3 was the intervention. Basically, a summary of my plan of action was that I would address issues on how to use the food Barnabas provides in a healthy way. So I would do that by giving nutrition education on the My Plate method to create a balanced meal. And from my time spent here witnessing phone call assessments with the dietitian here, I noticed that the clients, some of them held beliefs that frozen food is bad. So in the intervention, it will have a section addressing food misconceptions, such as that frozen food is unhealthy, or frozen fruits and vegetables. And then I also have a section about how to make canned food healthier and explaining that it's not all bad. So explaining how to reduce their sodium levels, because Barnabas does give out several cans of food. Step 3 is the intervention, which I was going on, continuing. I plan to address the benefits of the food groups that are in the My Plate method, because I want to ensure the community knows why these foods are nutritious. I don't want them to just hear about the method and not understand why it's important to follow it. And then I plan to give a few recipe ideas as well to inspire the community on how to use the My Plate method in real life with real food. Going off of that, 9.9% of the county's population suffers from poverty, making them food insecure. So this intervention will help educate those who are food insecure to come to Barnabas, and hopefully give them more tools to live a healthy life. And death from diabetes is high in the county, so there is a need for nutrition education on eating balanced and healthy foods. For step 4, monitoring and evaluating. So basically, how to evaluate this internship. To determine the outcomes of the intervention, the participants would be invited back and quizzed on how to create a balanced meal on either with a food model, or they can be invited back to a cooking class where they would have to create balanced meals, so that we could assess whether they really learned the knowledge that we taught. Another way to go about it is participants could be quizzed on the benefits of the food groups, the difference between whole or refined grains, and also asked to draw the diagram of the My Plate. You could track cholesterol levels of the participants of the class and have their levels at the start and when the class was given, and then continue tracking it every 2 months for a year to see if you could see their application of the My Plate method being successfully applied. Although for my class, I don't know how much that would really affect their cholesterol levels, but that could definitely be done. And I've just listed my references, and that's all. Thank you.